Good morning, Dr. Navi.
Good morning. How are you?
Wonderful. Welcome to Second Opinion with Dr. Ken Navi. Dr. Ken Navi is a physician in our community that we often approach with lots of questions. And one of the questions that's been pressing us is the violence in our community. And you had some very strong opinions and viewpoints about it. Would you mind sharing those with us this morning?
Certainly. The reason why we're not able to come up with solutions to the problem with violence in the community is because we're not coming up with the appropriate diagnosis. For example, root causes of violence. When you look at a condition, if a patient comes to me and says, Dr. Navi, I've had this cough for 2 weeks, can you give me something for it? The first thing I do as a scientist is ask questions. How long have you had the cough? Have you had any fever and chills? What does the sputum look like? Are you short of breath? I don't just say, here, take some Robitussin over the counter and you'll be okay, because that would be misdiagnosing you. Community violence, the root causes of community violence are really clear. Mental illness. Now, when we talk about mental illness in the community, we're not talking about your schizophrenic or your schizoaffective person. We're talking about people who have moderate to severe mental illnesses that do not have psychotic features. These people look normal. These people don't always act normal, but these people are suffering from a variety of mental illnesses that have with them impulsivity and antisocial personality traits. What am I talking about? Personality disorders. When we talk about mental illness, and we'll go further in this in a lecture series we're going to do in July, we're talking about, we go from the spectrum of psychotic mental illness like schizophrenia all the way over to milder mental disorders such as depression, bipolar disorder. But when you talk about patients or people who are suffering from a personality disorder, it's a totally different breed and it's impacting the community greatly. Let me go back to the diagnosis I was telling you about regarding the cough. If a patient comes to me with a cough and I don't diagnose appropriate pneumonia or bronchitis, I put that patient's life at risk, and whatever treatment I give them is going to be totally incorrect. I can give you Robitussin for a cough. If you have pneumonia and I don't give you the correct antibiotics, you're going to die. Same thing that we see in the root causes of violence. People with mental illness are lacking in certain fundamental sociological foundational pieces of their mind and their thinking, and it keeps them from acting appropriately. And if we don't get to the root causes of that, which are poverty, which are deprivation, which is a lack of opportunity, we don't understand how these circumstances evolve around a person and lead them to begin to behave in a way that we call antisocial or violent. So those are the root causes. You can do anything you want to do, okay? When you talk about tackling violence, you can have marches, you can have protests. I'm tired of looking at memorials. I'm tired of public officials on the television saying that we got to lock people up. None of that is what we need to do. What we need to do is look at this as this is what this is, okay? Public health epidemic. When we come back tomorrow, we're going to talk about epidemics, we're going to talk about pandemics, and we're going to talk about endemics. But the one thing to understand is that when you have a public health epidemic, which violence is, but violence is not the epidemic, it's mental illness. Violence is a symptom of the mental illness. So if you go to the root cause of the violence, which is mental illness, that means you have to marshal the resources that it takes to overcome a mental health epidemic in our community. So, what I want to talk about later, and what I'm going to talk about tomorrow, and so if you go, and you can go, I want you to look up grids from a historical perspective. Grids, HIV/AIDS, and Zika virus. And what we're going to do is we're going to talk about the public approach, or the approach that we took to dealing with all of these issues, and why we need a similar approach in dealing with the root causes of violence in the black community. 1,400 shot, 240 dead. That's an epidemic. Thank you. I'm Ken Navi. I'll see you tomorrow.